Hi, my name is Liz Parrales. My topic, preventing preeclampsia. Definition is a preeclampsia complication characterized by high blood pressure of the mange to another organ system. Most often the liver and kidney, generally preeclampsia begin after 20 weeks of pregnancy in women whose blood pressure had been normal. If left understand, preeclampsia can lead to serious, even life-threatening complications for both you and your baby. If you have preeclampsia, the most effective treatment is to deliver your baby. Even after delivery, feeling better, taking while.
Preeclampsia is a pregnancy-related multisystem disorder characterized by new-onset hypertension and proteinuria that can lead to preterm birth and can result in serious maternal, fetal, and neonatal complications, including the death of the mother or the baby. Professional organizations recommend low-dose aspirin in women who are considered to be at high risk for preeclampsia, but randomized trials have demonstrated inconsistent effects of aspirin on the risk of preeclampsia, and strategies for identifying high-risk women may fail to identify many women who subsequently have preeclampsia. Combined multi-marker screening using a combination of maternal factors such as age, race, medical history, and biophysical and biochemical measurements between 11 and 13 weeks of gestation has been proposed to improve the detection of high-risk cases. In the international double-blind ASPRI trial, investigators randomized 1,776 women with singleton pregnancies who were identified as being at high risk for preeclampsia on the basis of multi-marker screening to receive 150 milligrams of aspirin or placebo daily from 11 to 14 weeks of gestation until 36 weeks of gestation. The primary outcome, which was delivery due to preeclampsia before 37 weeks of gestation, occurred in 1.6% of the women in the aspirin group as compared with 4.3% of those in the placebo group, a statistically significant difference. Rates of neonatal adverse outcomes did not differ significantly between the aspirin and placebo groups. The authors conclude that low-dose aspirin in women at high risk for preterm preeclampsia reduced the incidence of the condition. Full trial results are available at nejm.org.
Nursing care. During hospitalization, blood pressure will be monitored every 4 hours, as well as vital function, fetal heartbeat, and uterine contraction in the same way. Diuresis will be controlled and biochemical, and hematological control will be carried out, which included coagulation profiles, renal profiles, urea and uric acid, creatinine, daily qualitative proteinuria, daily weight control, balance of administrative function, and eliminated liver profiles. They are more often, if necessary, fetal well-being will be affected and leads everything.
Preeclampsia can affect adversely both the mother and the baby. Firstly, as far as the mother goes, it can affect many organ systems. This is especially true if it occurs early in pregnancy and if it's severe. It can not only cause high blood pressure and protein in the urine, but it can also cause problems with the liver, and it can cause even problems with the brain. If it occurs early in pregnancy, it can also have a very severe effect on the fetus. The fetus can be growth restricted. In other words, it can be very small. It needs to be delivered early in pregnancy, so it has all of the problems that are associated with prematurity. and with that also come not only serious problems immediately after birth, but oftentimes long term. There is also now evidence that preeclampsia can cause significant problems in the mother long term.
Pros and cons. How quickly you should give birth depends on how high your blood pressure is, anything of liver or kidney problems, and the baby's condition. If your preeclampsia is severe, you may need to stay in the hospital for careful monitoring. If preeclampsia continues to be severe, the baby will likely need to the birth. If your preeclampsia is mild, you may to stay home with bed rest. You will need to have frequent checkups and exams. The severity of preeclampsia can change quickly, so you will need very careful monitoring. Emission application in Ecuador. In Ecuador, preeclampsia is one of the most numerous causes of serious complications during pregnancy and of mortality in the mother and child binomial, since there is rate of 21 of deaths per 100,000 live births, including maternal death due to obstetric causes occurring during the pregnancy. Children of postpartum permitted. Conclusion. According to the study carried out, we can conclude that sex respect one of the obstetric complications, with a high rate of maternal and perinatal morbidity and mortality, becoming public health problems worldwide that have been increasing every since, mainly in the developing countries development like Ecuador. Its causes are attributed mainly to different risk factors in which they predominant: maternal age less than 20 years and prematernity.
They figured that she needed to come out, and when she did, my sodium levels were incredibly low, and I could have been seizing or gone into a coma, so they absolutely needed to get her out. I had really high blood pressure that wouldn't go down I was on a lot of blood pressure medication. I was having these terrible headaches that wouldn't go away with medicine. And then I was in the classroom, but I had somebody helping me. So my feet were up most of the day, and they had swollen from about the knee down, and that wouldn't subside no matter what I did. It was severe preeclampsia. I went to a normal appointment, and that turned into me being admitted. 5 doctors walked in, and I looked at my husband, and I go, okay, we're about to have a baby. I knew immediately. There's only been about 12 cases ever of what happened to me that preeclampsia caused. It's called hyponatremia, which caused my sodium levels to drop. So I had just given birth to her, and I was rushed to the ICU, but I just kept thinking about trying to get down to her. And it took about 4 days for them to level out my sodium. I thank God every day that we delivered at Mercy, because I couldn't imagine me having to be treated somewhere else. And I also couldn't imagine her having to be transported, being able to stay in the same building, for my husband to be able to go back and forth and see her and come up and see me. When they discharged us, I think my husband and I were both feeling very bittersweet. We were very happy that I didn't have to stay here with medical complications. But we also were down the hall from her. There became a new kind of challenge and a new kind of hurt. It's not natural to be away from your baby, and it's just become a new normal for us. I come up here and hold her and try and be as close to her as possible, but it's weird to me to think that she would still be inside right now.